Hello, I'm Fiona Dyer and I'm a part-time orthodontic NHS consultant in Sheffield at the teaching hospital, and I'm also the Faculty of Dental Surgery representative of the Improving Working Lives Committee. We're here following the series of leaders and mentors in the field of medicine and dentistry, and today I'd like to introduce you to a leader in the dental field, that of Ulpee Darbar, who is joining us today. Hello Ulpee, nice to see you. Ulpee's been a consultant at the Eastman Dental Institute for 17 years, and currently you're the Divisional Clinical Director there, so welcome. So I'm going to start with the usual first question, Ulpee, and that is, what really attracted you to the field of dentistry?
I think throughout my training as a young person, I was always interested in probably doing something that helped people, and you saw benefit and a positive outcome and working with people. So that was always my interest, and I enjoyed the interaction. And I guess at the end of the training, I wasn't born in the UK, I was born in East Africa and then kind of moved countries, etc., finally coming into the UK in the late 70s, and then having to go through the A-level, the GSC process, etc. Coming to a hurdle at the end, sort of deciding which direction I wanted to go in, and it was dentistry I decided to do because I felt dentistry gave a much broader opportunity for females in sense of working hours, etc. And at that time knew about it but didn't know very much about it, and applied for it and got accepted and offered a place in Wales and haven't regretted it since.
So Ulpee, you've just mentioned Wales. I assume that's where you did your undergraduate training. Could you just tell us a little bit about your career?
I qualified in Wales in 1986. I did the short training programme that the University of Wales was offering then. And at the end of my training, I was very clear in my mind that I get bored very easily. And I didn't kind of see myself going into general practice. So I applied for house jobs in Cardiff, was not successful. I came back to London because that's where I originally based. Had a terrible time trying to secure a job even in a practice because I was a female, and this is going back quite a few years ago. I had no experience, and I finally managed to get a job where I was working single-handed with a principal who wasn't there on the days I was there, pretty much building my own book. And within 3 months I'd built nothing into a very successful setup, and continued to apply for house jobs, got a job in Cardiff, again where I trained, and had the greatest pleasure of seeing my principal and saying I'm going, at which point he didn't want me to leave. So I ended up going to Cardiff, and then that was how my hospital career started. I did a house job in Cardiff that followed on with the senior house officer position, which then took me within a year to Wales, Swansea at Morriston Hospital, where I did another senior house officer job in oral surgery. But I was very clear at the end of that my field was and my passion was periodontology, and at that time they didn't have the structured training pathways. I applied for a periodontology registrar post at UCLH many years ago, and came and did that, and was in the unfortunate event where the hospital was due to shut down a year later. So I ended up then applying for a restorative post in Bristol, and at that time training posts had become a lot more structured. And ended up taking a training program in Bristol in restorative dentistry as a registrar, at the end of which I applied for a senior registrar training program at the Eastman in 1993, came to the Eastman and have been there ever since.
Very good. So you explained obviously at the beginning that it was difficult for you to get into practice, possibly because you were a female. Did you have any sort of a mentor or somebody that you could look at and follow? Or did you have any help in that direction at all?
Actually, no, none at all. And it was a very, very difficult time because it was very disillusioning having gone through 4 years of training, knowing what you wanted to do, and you just couldn't get a gap in. And the person who probably made the hugest difference was one of the consultants I worked with in Cardiff, who was obviously one of my educational trainers as well, called Martin Addy. And he gave me the opening that has enabled me to progress to where I am today.
Very good. So, Ulpee, do you think that in light of the experiences you had early on finding a job, that do you think it's any easier for today's young dentists to move forward with their careers?
It's probably a little bit more easier. When I was applying for jobs, certainly when I was applying for senior registrar jobs, I remember going to interviews, and at one point, having come to London, looked at a job that was split across 3 hospitals, having had met a couple of consultants who actually sat there, because I was applying very early on. I was applying for senior registrar posts pretty much about 4.5 years after qualifying, so it was quite early on. Having been told that you haven't got the experience, well, you know, your face won't fit because you're not a man, etc. I still ploughed on, and I had a consultant who I worked with very closely, who was my program director at Bristol, who was very supportive, because at that point I'd gone back saying, I'm ready to throw everything in the bin, you know, just forget this is not worth it, etc. And had he not stepped in and encouraged me to go on, I probably would be in a different place today. I think today it's a lot more different, because, you know, at that time you were talking about, you know, 1 female applying for in the midst of 10, 15 males, whereas today the distribution is far weightier towards the females. And now we see, you know, even if we look at the cohort of trainees we have, we've probably got more female trainees than we have male. So it might reverse itself.
Yeah, it'd be interesting to see, won't it?
Yeah.
You know, I noticed in your time as an NHS consultant that you've taken on a huge number of leadership roles, and I just wondered what you think makes a good leader.
I think when I first took on my consultant role in 1997, I took on a department which was in a very challenging place. As the only NHS consultant, I had to reorganise and rework the whole department with a group of people who were very well established. Was I know better, you're only just young, you've only just trained. So that was quite a big hurdle, and I guess it just immediately enabled me to just take on a role where I had to change the whole setup, and that led on to other leadership roles within the organisation itself. The question about what makes a good leader, I think probably what made the difference was I am a people's person. I have got no airs or graces about the role I have. Everybody knows the role I have. And I work with people, but it's being approachable, working with people and not creating that sort of, but most importantly, having a vision and a direction to help take people with you. And I think that actually makes the biggest difference, but I suppose also having a sense of humour with it.
Yeah, no, very good. So obviously you've come across many challenges during your working time. What do you feel at the moment are your immediate challenges ahead?
My immediate challenges are, you know, as Divisional Director for the Eastman, my objective is to take the Eastman to a position of world-class reputation. Now, the Eastman does have a reputation. I represent the hospital. I have an institute director who I work very closely with. And the partnership itself is a partnership that we would want to look at moving forwards. But certainly on the NHS side, there's been so much turbulence within the NHS. And the biggest challenges we're going to have is sustaining the high-class delivery of patient care against the financial challenges, the educational challenges, etc. Further on from that will be, you know, I enjoy thoroughly the role I do, but it'll have to end at some point. What will be the new pastures? Who knows?
Very interesting times ahead, I think. Obviously, great career success. Your CV is exceptional. Do you feel that there's been any costs, you know, that it's come at for you at all?
Actually, not really, no, because I think what I've done, what I've achieved in all the different jobs I've done, the leadership roles I've taken on, the role I do at the moment, because over and above the clinical director's role I do, I'm regional advisor for the college, I do quite a lot of other stuff for the Edinburgh College. So all of those are quite sort of high-powered, demanding positions, but I kind of balance it up quite well, where I know when I want to draw the line.
Good.
So it kind of works at a mixed level. For sure, there are some times when, you know, you have to give it your best and something else has to take second place, but I've never kind of felt that I've had to compromise because of my job.
Yeah.
And I think I'm probably fortunate in that I don't kind of work with living things. I look at things, take them on board and then just move forward as I need to.
So how have you achieved this wonderful work-life balance that you have?
I don't know, probably have a very positive attitude. A can-do attitude in these sort of roles makes a huge difference, because the challenges are great and you sometimes are surrounded by a lot of negativity. And you know, that level of negativity can draw you down sometimes, but it's having a positive attitude. I wouldn't want to be sitting here saying, well, I never have a negative day. That would be a lie. Yeah, we all have those bad days, but I mean, it's just trying to look at the positive side of it and moving on, really.
Yeah, very good. And have you got any final thoughts for perhaps some younger generation, people that might be listening to this podcast, about sort of tips they can take from you in how they can move their careers
I think
forward?
the key thing I would probably say from the progression I've made, and it's not been easy, if I can get to where I am, it's my determination and vision that has enabled me to get there, and believing in myself. And I think if anybody young is actually coming out on the post, they will come across people who will try and put them down, who will try and not encourage them. There's always going to be an excuse. But if they actually believe in what their passion is and what they want to achieve, anything's possible.
Oh, lovely. Thank you, Ulpee. It's been lovely to meet you, and thank you for being such an excellent role model for us in the field of dentistry.